So thank you very much for the opportunity, Richard. I think there is some very exciting development in the medicine, AI hardware. But how do we make that accessible and affordable to the masses? How do we use them to benefit the society as a whole? That's the topic of my presentation today. So anybody here, how many people here have heard of Prudential? Good, so there's a demographic profile. So Prudential is one of the largest and probably the oldest life insurer in the UK and probably in the world. And we even have the phrase in the English language called the main crew. It's the gentleman with the bowler hat going knock on door and door to collect premiums. But if you talk about, we still have the main crew today. That most likely going to be is a 25-year-old Vietnamese girl riding bicycles in the villages, because that's where the growth is. And this one, by the way, is probably the last time you're going to see this slide being presented, because we just completed a demerger within the company. So we demerged our UK and European business from the rest of the group. And why is that? Because Asia is where the growth is. So there are several key factors. One is the rapidly growing middle class. So in the next few years, this is 88% of the next billion entrance into the middle class will come from Asia. Also, Asia is rapidly aging. So there are 200 million senior citizens in China, more than the whole European country senior citizens combined. And if you look at by 2050, there will be 450 million senior citizens in Asia. And just look at some examples. Malaysia. So in Malaysia, unequal access to healthcare, long queue, not enough specialists in Malaysia. 15% population will be aged 65 or older by 2050, tripled from 2010. High prevalence of NCD, non-communicable diseases. 73% of deaths are from NCD. Double-digit healthcare inflation, the third highest in Asia. And also out-of-pocket. I mean, most of the financial burden of disease treatment fall on the patient, the customer. 35% out-of-pocket. WHO recommended is 20%. Indonesia, this is, I didn't believe the number, but when I first saw it, it's a study done by Oliver Wyman. A third, 30% of the GDP is lost due to disease. That's the economic cost of diseases in Indonesia, 30% of the GDP annually. And they need 15 times more doctors just to meet the standard of OECD. And also, like Malaysia, the access to healthcare, quality healthcare, is very uneven between rural area and urban. So for example, 50% of the hospitals are located in the urban area, while 80% of the population live in the rural area. That's resulted in the 15-year difference in life expectancy between urban and rural area. But what about developed world? Singapore, Richard's hometown. The good news is Singaporeans live longer. In this year, their life expectancy in Singapore is 85 years, the longest in the world. The bad news, nearly half of the Singaporeans are not financially prepared to live that long. So, how can technology help? I think this is the chart on the left is not so pretty version of the chart I think Alex has shown, the intervention chart. And technology can help to not prevent the inevitable death, but prolonged postponement. So for example, if you look at the main health drivers, 50% are lifestyle, smoking, drinking, exercising, diet, 20% environmental, pollution, 20% genetics, and 10% clinical care. Technology, I think somebody did study, I think 70% of that can be intervened by using technology. So this is an example. We did an early initiative project in Hong Kong. We partnered with a company called Prudential, and we sent out 195,000, it's a DIY DNA testing kit to existing Prudential customers. And the result was very encouraging. On the bottom, you can see that 88% people, the users, understand more about their diet and nutrition. And 94% people, as a result of understanding their diet and nutrition, live a healthier lifestyle and even losing weight. These are some studies done in the UK. The data from the left is from the Babylon, which I know they will be joining one of the panel discussions. But doesn't matter which result you see, it's a significant improvement, significant and measurable improvement in admission rate, adherence, medicine, use of medical resources, and higher patient satisfaction. So in Prudential, we launched a much more systematic, broader, and strategic initiatives called ecosystem, where we create a platform, and we carefully selected and complementary partners onto this platform to create an end-to-end health management, end-to-end and personalized health management solution to our customers. And in the end, we hope to transform the insurance industry. And for people who has insurance is all about protection, right? We pay you when something bad happens. But trust me, the patients or the customers don't want to get bad things happen to them. So with the technology, with those end-to-end solutions, we help to, we still do protection, but we hope to move to prevention of certain critical illnesses, which is the most painful and impactful for the customers, and also postpone the inevitable death. This is not just a strategy or something in theory. We actually launched it in Malaysia. Anybody here from Malaysia? Oh, great. So we launched it on the 8th of August. And in the prevention area, we partnered with Babylon Health, in here also known as the GP at hand. GP at hand? I think that's what they call it. Yes. Hey, Mario. So we can do digital health assessment and also symptom checker. And the benefit for customers is they can get personalized medical advice more frequently and earlier. And I'm sure Mario will tell more about it. On the postponement side, we partner with TikTok, which is another UK startup, which provide personalized lifestyle and wellness training, coaching for the customer. Chronic disease management, protection, that's our bread and butter. We partner with telemedicine providers. So before you're sick, remember we talked about 80% of the population in the rural area, how do they access to the hospital? But now, with our app, you can actually talk to a qualified, selected doctor 24/7 from your phone, telemedicine. In Singapore, we partnered with a company called MyDoc. Now, we offer that services free to all Malaysian residents and citizens. And we estimate in 5 years, we're going to save the healthcare, not the overall healthcare cost, just for the patients, the users, between 4 billion to 6 billion ringgit, which is about 800 million pounds to 1.4 billion pounds. It's quite significant savings. It's not just the economic cost. They're also more convenient for the customers. Anytime, anywhere. You don't have to wait in the queue. You can do it anytime. We use chatbot. I think Bob talked using chatbot. Much quicker response. Now I just want to show you a video. No, by the way, all those solutions are offered in an app we just launched called Pulse by Prudential. Just show you how it works.
Introducing Pulse by Prudential. Powered by AI technology, Pulse is a health and fitness app that provides you with relevant health insights and solutions, especially for your needs. This app demonstrates Prudential's commitment to help Malaysians get healthy. You can get an online health assessment, understand your symptoms better, talk to a doctor virtually, stay alert, and predict the next dengue outbreak, all through this app. This app covers 3 components: prevent, postpone, and protect. Prevent. Gain health insights through your digital twin. Check symptoms through an AI-powered chatbot and track the latest dengue hotspots. Postpone. Improve your lifestyle with simple and useful wellness management. Protect. Talk to a doctor anywhere with the online consultation by Doctor On Call. So what are you waiting for? Share this amazing app with your friends, family, and customers now. Download the app and be rewarded today. Just flash the app to the barista and enjoy 10% discount on the a la carte menu at Starbucks. All Malaysians are entitled to enjoy this reward. Start winning at health. Pulse, revolutionizing the way we do health.
It's only available in Malaysian App Store right now. But we launched on the 8th of August. And we had about, on average, about 10,000 installs a day. So quite significant. Okay, so one of the lessons we learned in rolling it out in this health ecosystem is it's actually critical toward the public-private partnership. So we launched, this is the launch day, 8th of August. On the left is our group CEO, Mike Wells, and on the right is Dr. Ahmed, the Minister of Health in Malaysia. And I just read some quote from Dr. Ahmed. Pulse is a great example of how the public and private sector can work together to help empower people to be more proactive, preventive, and promotive in their approach to healthcare. With instant, reliable, and relevant health information at their fingertips, people will be able to make more informed decisions when it comes to managing their own health. Now, I think a lot of talk about, when we talk about longevity is about health, about medical, but there's a saying in China, what's worse than die early? You run out of money before you die. So the wealth and health are both sides of the coin, same coin. I don't have enough time to talk more about the wealth ecosystem, but we're in the process of building it. For example, Indonesia, we partnered with a mobile wallet provider called OVO to offer payment protection for customers. In Taiwan, we launched a robo-advisor. I think some of the earlier slides mentioned that. So what basically robo-advisor do is to democratize the wealth management function. In Taiwan, we have a D2C business wealth manager for clients, but to qualify for personal wealth manager, you had to have a $3 million net worth. Not many people do that, even in Taiwan. But using a robo-advisor, you can get quality asset management advices, almost as good as a personal advisor. So, in a nutshell, I think by doing the ecosystem, wealth and health ecosystem, we want to redefine insurance, not just as protection, but making customer healthier and wealthier while they live longer. Thank you very much.